Hi, I'm Karan Johal, orthopaedic foot and ankle surgeon here at Hatfield Hospital. A bunion is essentially a bump on the inside of the foot which causes the big toe to point outwards. Patients can often get red, inflamed skin around the bump, and this can be quite prominent and painful. Bunions particularly occur in patients who have a family history of the condition, and it is much more common in patients who wear narrower shoes that force the toes into an abnormal position. It is more common in patients who wear high heels, as this particularly causes the toes to be pushed together in an abnormal fashion. Patients with arthritis, either osteoarthritis and rheumatoid arthritis, can develop bunions, and unfortunately they are a very common problem. With the fact that bunions are very common, it is important that someone who assesses bunions commonly is able to have a look at them. Initially, the degree of deformity of the big toe is assessed as to whether the bunion is able to be corrected into a normal position on examination, and as to whether it's starting to affect the other toes. As bunions worsen, they can start to cause issues with the second and third toes. It's important to assess the joint itself as to whether there's any pain within the joint which might indicate some arthritis along with the bunion, as well as looking at pressure areas around the big toe and around the other toes, particularly on the sole of the foot, as with bunions, the big toe joint is not doing its fair share of its work, and it puts extra stress on the other joints. Diagnosis is often with x-rays, and these need to be with the patient putting weight through the foot to accurately assess the degree of the bunion, and potentially an MRI scan to look for other causes of bunions or evidence of early arthritis which may not be manifest on an x-ray. The treatment options for bunions in the initial stages always consist of conservative measures such as appropriate footwear choices, trying to avoid pushing the toes together by wearing wider shoes with a deeper toe box. Spaces and splints can often prevent worsening of the problem, and they can be used initially. For a good proportion of patients, if these simple measures are working, nothing more needs to be done. However, when pain from bunions starts to affect all footwear choices, affects activities of daily living, and is very painful and restricts other activities, a consideration of surgical correction can be thought of. In terms of surgical correction of bunions, there are various methods in the way in which this is done. The vast majority of this would involve a combination of redirecting bones, tendons and ligaments around the big toe to straighten it. Now, with modern techniques that we are able to employ, this minimizes the insult to the soft tissues and uses bespoke smaller metalwork which is often buried within the bone to cause less irritation of the tissues. Surgery is often undertaken as a day case operation, and minimally invasive techniques are also possible with very small scars in appropriate cases. Surgery is also possible under local anaesthetic, and patients are able to immediately put weight through their foot, often through the heel, straight after the operation, which aids recovery. Recovery time can be variable and may well depend on the degree of the bunion and the degree of surgery that's undertaken, and whether it's combined with operations on the other toes, which can often occur with bunions. However, for the first 2 weeks, it is of paramount importance to keep the foot elevated to prevent swelling and prevent wound problems. And beyond the first 2 weeks, the foot still needs to keep elevated whilst not walking on it. And normally at the 6-week stage, if those measures had been adhered to, swelling and pain is at a minimum, and normal footwear can be attempted at this point. If in larger reconstruction of bunion surgery, can often be the case that it may be slightly longer than this. Recurrence of a bunion following an operation is possible. However, using the modern techniques that we're able to utilize, this is much less likely. If appropriate care and attention has been taken to assess other issues around the foot, particularly issues at the back of the foot or with the smaller toes, the recurrence of any bunion is much less likely. That is why it is important that your bunion is assessed by an appropriately trained orthopaedic foot and ankle specialist who will be able to advise you on the best course of treatment. For any bunion-related issues, patients can be referred either directly via One Hatfield or from my private secretary.